Okay. Good evening, everyone, and welcome to the Pain Management Center of America's Health and Wellness series. Before we get started tonight, we'd like to go over a few housekeeping items. If you're listening with your computer speakers, make sure your speakers are on and the volume is turned up to the optimum level. If you experience audio issues, you may dial into the conference using the dial-in number listed on the webinar invitation link. If at any point throughout tonight's webinar you experience technical issues, try refreshing your stream. If this does not help, exit out of your browser and log back in the webinar the same way you did before. If you have any questions tonight, feel free to ask them using the Q&A feature at the bottom of your screen. And now I'll turn the webinar over to Dr. Mangiacani.
Thank you, Melinda. So thank you all of you for attending once again today's webinar. As we say that do not want to connect with the patients and in a manner that you personalize. So we are connecting with our psychologists personally here, and they are moving from giving psychotherapy and psychological assessment and assistance to our patients. Now they are doing to our staff, including the doctors. So I always had, when Bert was working here on a full-time basis, whenever I called him, he used to say, "You want me to come and talk to you?" So we used to talk about a lot of issues and the soothing my mind. So the same way, I'm observing a lot of our people are having problems. So before we go there, I want to tell you that Shelley and them are have opened multiple offices now. They have offices in Mayfield, Murray, Paducah, and they accept Medicare and Medicaid. And they are doing psychological evaluations for stimulators really fast. So we don't have to wait, and also go through a lot of troubles, scheduling, etc. That they will take care of that. So I'm also trying to talk them into opening one in Hopkinsville. So today's topic is anger management and conflict resolution. The subject actually came up because there were complaints against physicians as well as managers, and of course from the managers and physicians to the other members. But this also happens with not only with the staff, but also with our patients and colleagues, doctors among doctors each other, nurses each other, and managers, each department separate managers, and other employees. I think it is a very good thing to learn anger management, including for me. And when I was serving on the board of medical licensure, we used to send several physicians for anger management when we received complaints. I knew at least 2 of the doctors from Paducah were sent for anger management. So this is a very good opportunity. We really can't afford in modern day and age to afford individual care, but she will provide us an overview. And all of you who have seen the fee schedule, we just came out last night for physicians from Medicare. It looks like we are going to have cuts upwards of 10% starting January 1st. So call it Obama care or Biden restoration. Whatever we are doing, we are paying for all those things, and it will be about 10% total, could be even more. So it is very important that we behave properly and we maintain our anger and learn the conflict resolution. conflict resolution and anger management also helps you in many ways, especially improving the patient relations, in improving staff relations, but above all, it avoids and reduces malpractice cases. This has been proven over and over again. So it is very important to behave ourselves, and just like I always say that you treat others like you want to be treated. So again, Shelley does not need any introduction, but she's a licensed psychotherapist and does a lot of work in many areas. She wears many hats. Here she is. Thank you, Shelley.
Thank you, Dr. Mangiacani. It's wonderful to be back and to get a chance to talk with everyone. I'm just super excited to be here. I love this topic. This topic is geared for healthcare professionals, but you can also apply it to any area of your life. So I want you to really just take that deep breath, kind of relax, kind of get in the zone of just listening and being very mindful about what we are going to talk about. So here we go. Let's see. All right. So when we talk about anger management and conflict resolution, one of the things we want to talk about is really what your brain is doing when you're angry and how is that happening. So think about how your body feels. Think about when you really, really feel angry, what your body does first and what that looks like to other people. Melinda, on my screen, I'm going to click the control your screen, and I don't think I have access now.
It says you are controlling it.
Okay.
There you go.
Here we go. There's just a little delay.
Yeah.
Awesome. Okay, so perfect. So think about
You've muted just for a minute there. Can you unmute it?
how's that?
Perfect. Okay.
Perfect. Okay.
We're good to go.
So think about how it looks when you get angry. So I want you to step outside of yourself and I want you to think about how you actually look to others when you get angry. So first of all, look at work. Think of yourself in a work setting, maybe something today that really got on your nerves or annoyed you, and think about how you looked when you were annoyed, irritated, or upset. And then do the same thing at home. Maybe if you have children, they did something that annoyed or upset you, maybe your partner. But I want you to think about, number one, what that looks like. Because when we talk about anger management and conflict resolution, we get so stuck with convincing others what we think, how we see it, and how we feel. We get so engrossed in expressing ourselves, we forget what we look like. So first thing is, when you're really going to talk about controlling anger and handling conflict, you've got to think about how it looks to other people. That's key one. So remember, when we're angry, the limbic part of your brain, the fight, flight, or freeze, your stress response is what's working. It's saying, am I safe? Do people want me? It's where your emotions live. Okay. So think about that piece of it. And remember that your limbic system, of course, is where your emotional memories are stored. So when you're thinking about that, what are the main causes of anger in healthcare settings? And there's so many really great programs and really, really great trainings for medical providers. And that's come out of just the increased regulations, the increased stress. So I love that we're addressing this. This is not just one organization. This is just not one part of healthcare. This is healthcare as a whole. So look at that. Think about your suppressed emotions and your interpersonal relationships. Think about what emotions are you really suppressing at work? what aren't you saying, but you're feeling, and you're really, really suppressing. There's a lot of studies about the more that people suppress emotions, the unhealthier they are, the higher indicator of violence and aggression that they also have as well. And then people that have really great interpersonal relationships handle anger better, and they handle conflict better. So notice that people that get along well with others typically have a social IQ that's very high. So think about that. Melinda, I think my screen, there we go. So what I want to talk about is why now? Why is there such an emphasis on stress in healthcare? Because there's really important things that go on in the healthcare industry that don't happen in retail, that don't happen in the entertainment industry. So your industry is very specific. Number one, it's more competitive than ever. The qualifications to be a healthcare professional of any type, the regs have gone up to be able to do that, the competition just across the board, not to mention the standards of patient care and providing direct services. All of that is just increased and increased. The other thing is healthcare stress is sustained and repetitious stress. So I want you to think about that. Stress that you have, it's sustained. So what happens this Friday will probably happen again next Monday or next Friday. So it's repetition. It's constant stress. That's also very industry specific. And that's why it has such a negative effect on your physical and your mental health as well. So remember, in order to be good at something, you have to repeat it, right? So if you're trying to pick up a great skill in healthcare, you have to practice, practice, practice. Well, anger management and conflict resolution is the same. You have to repeat it and repeat those skills to be really good at navigating and managing that. So if you're not very good at controlling your emotions and your anger today, it's okay. You're going to start practicing tomorrow. And then in a week, you're going to be better. A month, you're going to be much better. 6 months, you're going to be tremendous. And then in 1 year, you could be identified as someone who could really lead others. Also, the increasing demands of regulations and the policies as a whole have made a difference. So those are really good reasons why you're so stressed. Okay, if you can see my screen, I love this picture of like the stress monster on the left. These are the main causes of anger that we talked about: the stress of the regulations, your suppressed emotions, and just not getting along well with some of the people that you work with, right? It happens everywhere. Some people mix like oil and water, and that's okay, but it's understanding and knowing that that's part of it. It's part of life. It's part of work. So how you express anger and the factors that affect you. What you don't want is, you don't want what I call a disruptive environment. So a disruptive environment is chaotic, it's challenging, it takes stress to a whole new level. There's not an environment out there that's perfect and totally calm and totally healthy at all times. That's not real life. But there are differences in disruptive environments. So you're going to identify the triggers in the workplace that lead to that very disruptive type of behavior. The University of California, San Diego School of Medicine actually has a 3-day intensive program just for anger management for brand new providers, medical providers. So I think that's interesting that universities are now acknowledging the high stress environment that we're going into. So you have to give employees, and think about if you're in charge of your department or you're working with others, you have to give them instruction, education, and the tools to diffuse and to de-escalate conflict. No matter where you're at, you're going to have to diffuse conflict and to de-escalate it. Okay, so think about that. Think about like a diffuser. You know, you put the oils in, you put water in, it smells good. It has some healthy benefits to it. You're diffusing that little bit of health everywhere throughout your environment. And that's what you're going to do. You're going to be a diffuser in your department. So we're very practical. And then the other thing is, when it comes to managing anger and conflict resolution, is all organizations have to have an immediate corrective action when inappropriate anger or conflict does occur. You can't wait until it happens. You have to plan for it. There's got to be a corrective action for when people do kind of lose their stuff. And most of the time when this happens, it's because they're going through a relationship issue, potentially a breakup or a divorce. They have their own health issues, maybe their own mental health issues. Maybe there's some outside stress, but when that inappropriate anger comes along, you have to have a corrective action plan that people know about and they don't want to be a part of. So I think that's really, really important when you're thinking about that. The other thing is, and if you don't remember anything from tonight, remember this. You can say difficult things in a very diplomatic way. Saying hard things doesn't mean that you're not kind. Saying hard things doesn't mean that you're heartless. Saying hard things, saying difficult things can be done in a very, very diplomatic way. And I want you to think about that. And I want you to really practice saying something hard. Everybody thinks you've got to say something loud or ugly. And really, that's just not the case at all. So think about that. The next thing I want you to really think about is, I want you to pull an image into your mind of someone who you think is a very good self-regulator, meaning that they manage their emotions well. When they're upset, it's okay to know it. But it's not okay to cuss, to yell, to scream, to throw things. It's okay to let people know when you're upset. But I want you to think about someone who's really good at regulating their own emotions. They don't have a lot of highs and lows. And when there are stressful events or conflict, they really, really do that well. So does everybody have that one person in mind? You know, as a therapist, I identify my own staff of good regulators, because I know that if someone's a good regulator, they're typically going to be a high performer, they're going to be low conflict, and they're going to be able to lead others very, very well. So those self-regulated people are really important in our organization. If you are not one, you need to become one. And a good self-regulator is not born, they are made. So identify what that looks like maybe growing up in your life. Who is someone that was calm and kind that you really admired? Okay, if you have that picture, then in your head, when you're angry, when you have real conflict, and there again, think of a real life situation that maybe happened today or this week at work, pull in that image first, okay, of what someone that looks like is a good regulator. That's the image you want to pull in. Remember, we get stuck in expressing ourselves, and that's where we lose our cool. There we go. So self-regulation is how you relearn how to handle conflict resolution. So self-regulation is how you relearn to handle conflict resolution. So look at your children, look at your friends, look at your neighbors. Who's a really, really good self-regulator? And that's what you want to implement. That's really the key of resolving conflict. You're going to know the procedure and how to address it versus yelling. You're going to stick to the facts, and you're not going to get personal. People that do a good job with handling conflict, they don't have less of it. They're just better at handling it. And you're going to be professional. So at the end of the day, when you go back to your desk and you say, wow, that felt bad, but it looked good. It didn't feel good having to have that conversation. But the fact was, I still really, really did a good job managing that. When you look at self-regulation, you're going to identify it in other people. You're going to relearn how to react to it and respond in a healthy way. And that's really going to be super, super important. So when you express your anger or your frustration to other staff, know the personality types that you're dealing with. So I'm going to talk a little differently. Even though I might say the very same words, I'm gonna deal a little bit differently with someone who's ADHD, who's borderline, who's histrionic, and who's narcissistic. I'm gonna say the same thing, but I'm gonna know who I'm dealing with. I'm gonna know what personality type they are. So if they're ADHD, they've got a lot going on. They're spinning a lot of plates. So I've got to be very precise and very, very focused on what I want them to know or understand or to do, because they process things differently. Borderline personality types, they love you, they hate you. They have good, one day they love you and the next day they may not. So they're going to have more conflict. Histrionic is just drama oriented. And that is someone who we call it elevates an issue, or they'll elevate a situation. And I call it watering it down. If I have a histrionic personality type, I just kind of water down what really happened. So know what you're dealing with when you are talking about really difficult things in conflict. And remember, you can apply this to your home situation as well. I love this picture, and I'm going to say it again, saying difficult things in a very diplomatic way. So, I have been a program director and a direct supervisor for many, many, many staff, many different facilities over many years. And it's hard to say things that are going to upset someone, but they have to be said because that's really that growth mindset that we want to get into. So think about that for a moment. Think about the way that you say things. It's called neuro-linguistics, and it's the way that you say things and how you say things is as important as what you say. So when you're handling a situation, you're going to breathe. You're going to pull in that self-regulation image first. You're going to know the procedure and how to address it. You're going to stick to the facts, and you're going to be professional. So let's talk about working with other people. Let's talk about how difficult that is. Most of us work in very close proximity to people. We share workspace. So when you don't like that person and the way they do things, how do you manage your emotions? You're going to say difficult things in a kind way, but you're going to be transparent and let them know, hey, this is hard for me. Like I do best whenever your stuff's cleaned up and there's less clutter. I do best if you're here early. I do best if you help me at the end of the day catch up. That sort of thing. The other thing is, as an employer, the fact is one of the best ways to decrease your stress is to improve your performance. Be the expert. The employees have to become experts. Employees have to follow and implement the documentation and the regulation requirements every single day as a practice instead of an event. When you work in healthcare, we are only as good as our documentation. And I've seen just amazing people who provided great care be terrible documenters. So when you really want to decrease stress and you really want to decrease anger and conflict issues, you have to up your performance. You have to start performing at a very, very high level, because the less level you perform at, the more the stress goes up. That's when things get dropped through. We call them the cracks, when things get missed, when documentation isn't done correctly and you're not reimbursed. So in order to decrease your stress, you've got to become that expert. And that means just knowing your policies and procedures. So for us, we have lots of different programs. Some staff work in a couple different programs. Some staff may only work in one. But the fact is, the people in those programs, they have to know their own performance standards, and they have to be the experts. They can't wait for someone else to do that. So if you're really going to decrease your stress, you're really going to increase your performance. And that gets back to working smarter, not harder. It's not more hours. It's better time management. It's better organizational issues. That's what helps your performance, and knowing what you have to do. So I think that's really, really important. Remember that your anger is a signal. It's a signal when you're in pain, distress, and it'll come in like a wave. So don't get sucked in to, the swell of the wave. Ride the wave and know that, okay, I'm going to let this emotion pass, and then I'm going to say something difficult in a kind way, and I'm going to walk away being very, very well regulated. So your anger is simply a signal. I'm very practical, and I want you to have practical tools. So remember, when your best efforts really don't work out, not everyone's going to be compliant. Some people are just high conflict people. So you have to evaluate where they're best used in your organization. Some departments can handle more conflict than other departments, depending on their task at hand. So your objective is to turn your conflict into a productive conversation. You're going to identify your best regulated employees, and you're going to have employees that go through a very simple and basic training. And and I call it on the hour training, and that is, you're always growing. You're always, when you're working, you're talking about things in shortcuts that are effective and productive, but still meet the regs. You're going to track and see what issues you continue to have. I like to do this personally. You can track issues on your phone. There's a lot of different apps, but if you're in a relationship that has a lot of conflict, it's good to kind of track some of those issues. And one of the things that we know that happens is, some people have a pattern of conflict, and you're going to see this at work as well. And that pattern of conflict is they may only be able to go 3 weeks without some sort of conflict. I'll call it, they may get into a disagreement. Other people can go a whole year. It depends on their personality type. But remember that tracking your issues personally and as an organization is very, very important. So track those issues. See which issues you can decrease and then get rid of. I think that's really helpful. There's a lot of studies that show that your anger expressions and your interpersonal problems are relevant in the healthcare industry because they're directly related to performance and mental health. So the way that you handle your anger and your conflict is directly related to how your mental health is. And so if you're healthy, you're probably managing those things really well. I love this one. This is the anger gem to remember. So you're going to control your anger by acting the opposite. When you want to really throw something or yell something, you're going to do the opposite. You're going to smile instead of frown. You're going to speak softly instead of loudly. When I work with schools, I work with educators on telling them how to educate their students to speak softly instead of loudly. Because the moment a teacher lowers her voice. It's like turning down the lights. And guess what we do? We lean forward and we want to listen, because all of a sudden the voice just got soft. That is way more effective than getting loud. When people yell and get loud, remember, they're engrossed in their anger expression. They're expressing to you how upset they are, which is why they're speaking loudly. So the gem is to speak softly and make people lean forward. Hey, what did you say? Instead of saying something really loud and ugly. You're going to relax your muscles instead of tighten them. You're going to reconnect with your sanity. You're going to empathize instead of judge people, and you're going to disengage rather than attack. Disengagement means not getting drawn in to the conflict. So you're going to explain and not defend. One of the best rules of conflict resolution is explaining but not defending, and that is stating the fact. This is our procedure. This is how we do it. This is how we document. These are the times that we need to work. That's a good explanation, but defending why you do those things sends the message to debate and to renegotiate. So you're going to explain but not defend. There again, it works really well in personal relationships too. Explain yourself, don't defend yourself. The cost of anger. So we know that the cost of anger means the death of relationships, jobs, reputations, and physical death. We know that losing your cool can make you lose your job, your reputation. I've seen people die from violent incidences when they weren't really aggressive or violent people, but they snapped, and that means they stopped suppressing their emotions and they released all at one time, and they had a physical death or a death of something. So that's one of the costs of anger. Remember that some people feel oddly calm after an outburst due to the discharge of the emotion. So a bad cycle can start there. And those are those people that they feel better after they've had this emotional release. That means that they grew up learning that the way that you expressed anger and like kind of throwing up all your emotions and all the things that you were thinking then gave you a few minutes or a few days of feeling calm. That's not how you want to get calm. But that's what a lot of people do. So you're going to improve the skill set. And the skill set is your own skill set. You're going to learn all of the areas of your job and all the areas of your relationship to decrease the stress. You're going to think about things differently. You're going to think differently about your job and about your employer. When I work with companies, I like to ask people in every department silly questions. And those silly questions are, what do you think the owners do on the weekends? What do you think the owners do when you're not here? And I love some of the funny questions that I get because they all tell me these pretty grandiose, things about, well, they think that they're on a beach somewhere and they've got a fruity drink and whatever, or they're just kind of partying it up. But when I really go back and say, well, this is what, the owner actually does on the weekends. They're working on this, they're here at this time. We punch holes in those incorrect views about employers. And I've yet to meet an owner who won't say to me, everybody thinks I make all this money. And while I may make a lot of money, they have no idea of the expenses and the stress that comes with that. So I love kind of punching holes in that. So you're going to improve your skill set and you're going to think differently about your employer or your relationship. And you're going to use those cognitive behavioral techniques of thinking about things differently. And that's your growth mindset. When we talk about conflict resolution, there's something called the wisdom pattern, and it's about order, disorder, and reorder. A growth pattern means this. It doesn't feel good to grow. If you think about when you were a young child and you were actually growing physically, most of us can remember like leg aches, body aches, that sort of thing. It really kind of hurt, or at least was uncomfortable to physically grow, right? As we grow emotionally and as we grow professionally, it does not feel good. That's one of the misconceptions, I think, in therapy and in life coaching is it's going to feel good when I start losing this weight. It's going to feel good when I accomplish whatever. The fact is, doing those things, that growth is hard. It's waking up early. It's restricting calories. It's restricting activities. That growth doesn't feel good until you have the final result. The final result feels amazing, and that's why we do it. But that growth mindset doesn't feel good. So when you're growing professionally, and that means when you're learning the skills that you need to learn, and whether it's documentation or procedures, you're going to know there's an order, a disorder, and a reorder mindset. So in working with large corporations, they typically have a very black and white order set. And what that means is there's a way that they just do things. And then what happens, that company goes into a different area. They've expanded, and all of a sudden there's a different community mindset. It's a little bit of a different culture. So then there's some disorder because maybe some of those things don't work there as well. Or maybe there's an event, a medical emergency that causes the disorder. And all of a sudden you have to redo or reorder. There again, this is a growth mindset. What this means is what worked initially, all of a sudden it wasn't effective for whatever reason, and there's disorder, there's chaos, there's stress, people are mad, they're angry, they're telling you they can't do it, they're overwhelmed, they're just exhausted. That's disorder. You have to reorder the disorder. And that's where you get that final result of a really great place to work and to be a part of, where people are performing at their best. The company's making more money than it's ever made. That's your growth mindset. So really think about that. Growth does not feel good, and you have to grow to manage your anger. You can't be emotionally stagnant and manage anger well. So I ask everyone, how do you remember all the information you have to remember to do your job? Okay, so healthcare, we have lots of portals, we have lots of spreadsheets, manuals that are thick. We have lots of accreditation entities that come in and review what we do. How do you remember all the things you need to remember on a daily basis? You show up tomorrow, how do you know what you need to know? Well, you've got to have your own handbook, your own cheat sheet, your own whatever for dummies, your own journal for your own self-improvement. So we give new employees a binder that's tabbed with all of our important things they might need to get to quickly. You know, now our policy and procedure handbook for like CARP is just huge. And there's, I think, 100, or I think there's 1,800 domains. But the binder that we give staff has all the important areas so they can quickly get to that. And I say to them, keep that on you. You may be able to go on the Google Drive and get that information. But what if you're at a clinic and you lose your Wi-Fi? What if you don't have access to it? You've still got your handbook. And that works differently for different people. But you have to have some way every day of reminding yourself of the important and difficult task that you have to do. Every department, surgery on down, every person has to have that one thing that helps them remember to do the things that they need to do. And working with lots of physicians, you know, they'll use things on their phone to remind them about how to do different procedures. In working with HR directors, they'll have things on their phone, or they may have a way that they track things that they can get to easily. Whatever it is, If you're really going to handle your anger better at work or at home, you've got to have something where you can track it and then remind yourself of what you really need to be doing. People walk around with all this information in their head, thinking they're just going to pull that up. Well, guess what? If you're stressed, if you had a difficult patient, if there was just a change in their care, you're not always going to be able to pull that up from memory all the time. And then one of the important things to keep in mind is when you're dealing with conflict resolution, quit telling the same people the same things. That's how you demand performance. So many managers will say to me, by noon, I want to pull my hair out. I've told 20 people the same thing 20 different times individually. So quit telling the same people the same things. Demand that performance. Have them say it back to you. You know, if someone says to me, so Shelley, you need to do blank, say it back to me. You know, if I have ADHD or if I have a processing or sensory issue, I may say it back in a way that I heard it, but it's not how it was supposed to be received. So having employees say it back is really good. We do the same thing with patients. We'll say, okay, at the end of your appointment now, say it back to me what you're going to be doing up until I see you next time. You know, what sorts of activities, what are you going to be doing? Have them say it back to you. That decreases your conflict resolution, especially with departments, because guess what? What kind of words and excuses do we get? I wasn't told, I wasn't trained, no one went over that with me. Well, that much must have changed. I don't remember that policy. But if you have someone say it back to you, they're more likely to remember. And remember that skills and willingness is really all you really need to change. So that's really that growth mindset. So I really like that one. What makes employers angry? When we don't follow procedures, when we cost them money, when they have to be liable or they lose a license because of care, when they don't have vested employees, when people job hop, they're always looking for the next big gig, when they go to a competitor to work. That's what makes employers angry, because they've invested in you and then those things can happen, or they've invested in me and those things can happen. In working for large healthcare organizations like I have, those things are very important at every level of care. No matter what position you have, that's a very important thing to keep in mind, that these things will make employers angry. So employees get angry when they feel like they're not compensated enough, when they're not valued, but they're overworked, when there's a lack of understanding about their personal and family responsibilities, when they feel like they're disposable. So remember that stress, anger, and conflict is due to the emotional energy we're expending every day. When you all go to work tomorrow, the energy that you will have expended at the end of the day will be enormous, right? And when you feel like you're just disposable, that's a very defeating mindset. So those are some of the things that employees tell me that make them really angry. Again, you're going to improve your skills to decrease your stress. If you show up knowing how to do your job, your stress is plummeted. Now, that doesn't mean you're going to show up and that really unhealthy worker that you have to work with is going to be there and be better. That doesn't mean that. It means that if you know your job well and the policies and the procedures and the documentation, then that's going to take a load off of your stress in that area and then help you manage the interpersonal issues so much better. You're going to take a deep breath and you're going to relax. You're going to remember a few things. Remember, I talked about carrying, something with you or having something on your phone. You're going to write down things like getting upset won't help. As I keep my cool, I'm in control. How good does it feel when you handled a situation that was really tough, but you handled it well? That's keeping your own control, and it feels good. So you're going to write that down. You're going to write things down like easy does it. There's nothing to be gained in getting mad, or I'm not going to let him or her get to me, which is really important in relationships. And knowing that we can't change that person with our anger. And then find a way to say what I want to without the anger. So no sarcasm. We call them snarky sharks. You don't need any snarky sharks in your department. Snarky sharks, they're snarky. They're sarcastic, but they say mean things, and it kills the morale of that department. So that's really interesting. When I work with large organizations on hiring people, we look for snarky sharks. So no attacks. Criticism can be very painful. It can make you remember being a child and being scrutinized. So it can bring up all those old things. Each of those feelings, there are potential for triggering anger, but it's really just a way to cover up emotional, painful situations. Remind yourself that whatever you're hearing is one person's opinion, and it's about a task and not about you. The fact is, healthy people are not healthy 24/7. Accept the fact you don't always do your best job. If you've been sick, if something's going on, it's okay to say, I'm running about 80% of what I normally am. That's normal because you're human. But you voice it, you let others know, and then you rest and recharge. When you grow, when you manage anger and conflict resolution, you've grown your skill set and you're going to help your organization grow, which then can offer more advantages to being a part of that. You can grow your own financial health. You can grow your own confidence in dealing with conflict. You can grow your very best life, but that growth is not comfortable. It does not feel good, and it takes a lot of work and effort. But that's how you get that very best professional life and that very, very best personal life. So you can do it. These things are not hard, but they do take a while, and you're going to repeat them day after day until you get really, really good at them. And I've had people that have said to me, we call it like anger recovery, like, hey, I was doing great for 3 months, and then I just kind of lost it. And I'm like, well, you know what? Relapse is a part of recovery with any issue, whether it's food or addiction, whatever. Relapse is a part of it. So if you're doing great and you have a setback or a relapse or a bad day, it's okay, because that's what growth is. But go out there, grow your best life, be your best professional self, and have your very, very best personal life that you want. Thank you very much. That was a lot of information. So I felt like I wanted to kind of get all of that in, but I want it to be specific to what you do. I want everyone to start tomorrow implementing some of those things. And you can email me at Shelley@emeraldtherapycenter.com with any questions you may not want to leave on here. And I'll be happy to give you some direction. Thank you.
Thank you, Shelley. That was a great presentation. We really don't have any questions or comments. I think we will share this video again and repeat it with people. And if you think we need a longer course, like San Diego, not 3 days, but 2-3 hours or something, we can arrange that. So if any of the members are interested in a longer presentation, please let us know. We will try to get that. Thank you. Good night. We'll see you again soon.
Thank you.
Good night.